Good afternoon. Thank you for joining us today on this Older American Month webinar, Flip the Script on Aging. We're glad that you were able to join. We have two great speakers that will come on and they will give you some good information that you can share with your seniors. At this time, I want to turn it over to our first speaker, Kayla Hernandez Uorler. Miss Kayla, you can take it over. Thank you.
Hello, everyone. My name is Kayla Hernandez Ujoa, and I want to thank Alma for the brief introduction. I want to welcome and thank you for joining us here today. For those of you joining us for the first time, I'm going to talk a little bit about what the Consumer Affairs and Outreach Division does, or as we like to call ourselves, CAOD. CAOD is the division within the Federal Communications Commission's Consumer and Governmental Affairs Bureau. We engage the public through outreach and education initiatives to inform consumers about important regulatory programs, telecommunication issues, and other issues that impact their day-to-day lives. Next slide, please. Today, we're going to be talking about several things. We're going to talk about connectivity as a tool to prevent social isolation, telehealth resources, virtual volunteer opportunities, and then my colleague Joshua Mendelson from the Disability Rights Office will join us to talk about hearing aid compatibility and captioning information. We'll wrap up with consumer and outreach partner resources, and I will be asking for questions. Please note that the slides will be shared with everyone who registered for the webinar, and also when it comes to the Q&A portion, I will be asking my colleague David Perez to see if there's anyone who has submitted questions via the Q&A. Next slide, please. Before we talk about social isolation, I do want to remind everyone that this is, of course, Older Americans Month. The FCC's webinar today uses a lot of its information based on the Administration for Community Living announcements, the theme for this year, which is Flip the Script on Aging. This focuses on transforming how society perceives, talks about, and approaches aging. It encourages individuals and communities to challenge stereotypes and dispel misconceptions. Again, wanted to remind everyone today the FCC, CAOD, and our Disability Rights Office will be talking about helping older adults stay connected and empowering them to flip the script on aging. Next slide, please. Social isolation is an epidemic that poses serious health risks affecting millions of people in the United States. On June 23, 2020, the U.S. Administration for Community Living, in partnership with the U.S. Health and Human Services Office of the Assistant Secretary for Health, established a cross-sector initiative coordinated by U.S. Aging to reach people who are socially isolated. And the Federal Communications Commission was one of those partners helping in this issue. The aim of the collaboration was to connect people living with isolation with programs and resources to build the social connections they needed to thrive. Launched as the Mobilizing and Empowering the Nation and Technology to Address Loneliness and Social Isolation, or the Mental Health Innovation Challenge, the goal was to develop an easy-to-use online system that offers recommendations for programs, activities, and resources that can help users connect to others and engage in the community based on their individual needs, interests, and also their abilities. This system would be helpful to combat the social isolation and loneliness that older adults, people with disabilities, and veterans often experience. Next slide, please. Today, because of this collaboration, we have what is called Commit to Connect. This came about because the winners of the Mental Challenge, the Social Health Connector, developed by NWD Virginia and the Virginia Department of Rehabilitative Services, and also United Way worldwide were announced at the January 2021 Consumer Electronics Show, also known as CES. CES is an annual trade show that is produced by the Consumer Technology Association. At this show, the winners demonstrated how to use this tool. The Commit to Commit strategies consists of increasing awareness and availability of programs and strategies that address social isolation and loneliness, and also to grow social connections. It also builds and strengthens collaboration with current and potential partners to leverage collective efforts, resources, innovations, and activities that increase social connections in the United States. Next slide, please. We're going to cover a little bit about the FCC's efforts in telehealth. Next slide, please. When the FCC discusses telehealth, there are three definitions that we look at. We look at telemedicine, telehealth, and telecare. Because of our focus on telecommunications, the FCC also has its Connect to Health Task Force, which I will talk a little bit about later. And this includes how the definitions are used. For telemedicine, it can be defined as using telecommunications technologies to support the delivery of all kinds of medical, diagnostic, and treatment-related services that are usually provided by doctors. For example, this can include conducting a diagnosis test, closely monitoring a patient's progress after treatment or therapy, and facilitating access to specialists that are not located in the same place as the patient. Telehealth is similar to telemedicine, but it includes a wider variety of remote healthcare services beyond the doctor-patient relationship. It often involves services provided by nurses, pharmacists, or social workers, for example, who help the patient with health education, social support, and medication adherence. This also includes troubleshooting health issues for their patients and their caregivers. Captioning, interpreting services, and other accessibility services can be available upon request. And then we have telecare, which generally refers to technology that allows consumers to stay safe and independent in their own homes. For example, telecare may include consumer-oriented health and fitness apps, maybe sensors and tools that all connect consumers with family members or other caregivers. There are exercising tracking tools, digital medication reminders, or even early warning and detection technologies. Next slide, please. So how does this all fit to the Connect to Health FCC task force? The slide that is on the screen has all of the ways that the task force helps in this area of telehealth. For the interest of time, I will not go over every single one, but I did want to point out a few. The task force is working to raise consumer awareness about the value of broadband in the health and healthcare sectors. The task force also serves as an umbrella for all FCC health-oriented activities, including promoting effective policy and regulatory solutions that encourage broadband adoption and promote health IT. It also includes identifying regulatory barriers and perhaps incentives to the deployment of advanced healthcare technologies and devices. The task force also engages a diverse array of traditional and non-traditional stakeholders to identify emerging issues and opportunities in the broadband health space. Next slide, please. We're going to be covering a topic that's very important to a lot of my colleagues here, virtual volunteerism. Next slide, please. The FCC sees virtual volunteerism as a possible way to address the social isolation issue that was just previously mentioned in this webinar. In December of 2020, the FCC's Consumer and Governmental Affairs Bureau, CGB, hosted a webinar to highlight virtual volunteerism, which is the practice of leveraging broadband to match individual volunteers with nonprofit organizations to provide direct services to those in need. This slide in the presentation includes several examples of organizations that continue to engage in virtual volunteerism. And a lot of these organizations were also part of that December 2020 webinar that we hosted. For the interest of time, I will just pick a few examples of the types of organizations that provide these services. One is the online volunteering service of the United Nations Volunteers, or what the United Nations call its UNV program. This connects volunteers to UN entities, governments, public institutions, and civil society organizations. We also have a very well-known organization, AARP. ARP offers a variety of opportunities which volunteers can choose from the convenience and comfort of their home to participate in. Next slide, please. And now I turn the program over to my colleague, Joshua Mendelson, Attorney Advisor for the Disability Rights Office, which is also housed within the Consumer and Governmental Affairs Bureau. Josh?
Thank you so much, Kayla. I really appreciate the invitation to be here today. Like Kayla explained, my name is Josh Mendelson. I am an attorney advisor with the Federal Communications Commission within the Disability Rights Office. And we work very closely with Kayla and the other sections to ensure accessibility of telecommunications, as well as video programming, and also emergency communications for people with disabilities. Now that includes things like captioning, telephone networks, emergency calls, television broadcasts, and all those other areas. You know, as we get older, unfortunately, in many cases, our hearing sometimes gets worse. For many Americans, some of them are living with certain degrees of hearing loss in their lives. And for many of us, hearing loss is in fact severe enough to have an impact on how one understands information and how we access the people around us, or how we access what's being said on television or on the telephone. And these things have an impact on our abilities to engage and communicate with the people around us and to better understand what's going on in our environments. And in many cases, that leaves us feeling very isolated. Now, let's flip the script on this. Let me tell you about how the FCC can help you in these types of situations. Next slide, please. So the first way is by a mechanism known as hearing aid compatibility. That ensures that hearing aids are compatible with certain devices out there. The FCC regulates this area. Now, there are a number of federal laws that require the FCC to ensure availability of wireline telephones. And when I say wireline telephones, I'm referring to corded telephones. There may also be wireless phones. There may be certain phones that plug into a handset that might be in the middle of your home. But in any case, these are generally phones that use a line that still plugs into the wall, like a traditional telephone. Now, those wireline phones must be compatible with hearing aids and with cochlear implants. So this means that these devices should be able to couple with hearing aids through what are known as telecoils. And that's a special setting that's available on hearing aids that is able to provide a reasonable volume range. There are also some additional requirements related to going back to lower volumes. So when the person answers the next call, they're not, deafened more than they are by the louder volume that they've had in the previous call. Now, when a person purchases a new wireline phone, that package should indicate whether or not it is hearing aid compatible. That way, if and when a person is purchasing a new hearing aid, which actually has just become easier with the over-the-counter hearing aids that are available, otherwise known as OTC hearing aids, or if a person is even using something such as ear pods compatible and using those with their hearing aids. Or if they are using a telephone, those should be compatible with the hearing aids as well. And that ensures that a person is able to hear more clearly what's being said on the telephone. Next slide, please. You know, more and more of us are moving to cellular networks, otherwise known as wireless telephone services, such as Apple or Android devices. The good news is that for now, most but not all wireless handsets offered for sale in the United States must be hearing aid compatible. Now, we recently changed that rule to require that all wireless telephones become compatible with hearing aids. Now, that transition period will take some time, and that will come into effect by June 12th, 2028. In order to be hearing aid compatible, hearing aid manufacturers, or rather companies, are able to meet standards for coupling and T-coil compatibility. That includes Bluetooth coupling technology as well. And so when a person is purchasing a new wireless device, the packaging for that device and the instructions within those packaging should be made clear. There is also a link to a website that is available on this slide that has more information regarding hearing aid compatibility. Now, know that we will be circulating a copy of this document as well, and this PowerPoint will be sent out to the participants who were fortunate enough to be here today. Next slide, please. Another way in which the FCC can assist older Americans is through the provision, or rather through our requirements, that there be closed captioning on video programming. Now, that includes video programming itself, which I'll talk a bit about first, and that also includes the closed captioning of conversations on the telephone network. Next slide, please. Now, I'm sure many of you are very aware of closed captioning on television, generally on television broadcasts. So when we talk about broadcast television, that usually includes cable stations. Right now, the requirement is in place that mandates that all video programming that has been produced after 2002 be closed captioned. And that includes both English and Spanish television shows. Now, there are some exemptions in place in certain circumstances due to budgetary restrictions, or depending on the time of night that show is aired, or if there are certain network exemptions for newer networks. But generally speaking, all video programming that is on the television must have closed captions. And those captions also have to be able to identify turn taking in terms of who's speaking on TV. And they might even indicate precisely who the person is that's speaking. They should also identify background noises or other things that are happening on the screen, such as the knock on a door or a ringing telephone, or perhaps a crying baby, or even music. And so, as we are also very well aware of, there are more and more video programs that are becoming available through the internet. And we have a different set of rules that are somewhat less stringent than our video programming rules. Right now, our requirement is that if a video program was shown on television with captions in the past, then that programming rather, and then subsequently that programming is made available on the internet, under certain circumstances, that program should also be shown with captions on the internet as well. So that means all of the reruns of the Golden Girls that have been shown and broadcast on TV that are now being streamed on Hulu, for example, must be shown on Hulu with captions. Next slide, please. Like I pointed out earlier, our rules regarding streaming and internet video programming and closed captions are not as stringent as broadcasts on television. For example, there's some original programming that's shown on streaming services such as Netflix or Apple TV that was never shown on broadcast television or cable programs in the past. That doesn't have to be captioned. Now that is in accordance with our rules, that is FCC regulations. So that means that shows like Ted Lasso that are being aired on Apple TV under our rules are not required to be captioned. Now, there are other federal laws in place that may cover captioning, such as, for example, the Americans with Disabilities Act, or other legislation, such as Section 504, and laws that are in place that do mandate that some of those programs. Please excuse us. So many of those larger video streaming platforms, such as Netflix or Hulu, usually do caption their program, most, if not all, of their original programming, in any case. Now, if there is a video program that's available in another language other than English or Spanish, our rules would not apply in those cases. Likewise, if there is an English language program that has already provided subtitles for that program, then our rules would not require them to additionally provide closed captions. Now, that's somewhat unique because when it comes to subtitles, oftentimes the subtitles don't identify the speaker or necessarily give the viewer an access to background noise, such as those knocks or crying babies, like I mentioned earlier. So if I, as a deaf person, for example, were watching a program that had subtitles, I would miss the fact that somebody might be knocking at a door or ringing the doorbell in the video programming itself. Additionally, our rules do not apply to user-generated videos, such as postings on social media platforms such as Snapchat or Instagram. Our rules would not apply in those contexts. Or the creation of home videos, for example, wouldn't have to comply with our rules. Now, in regards to commercials that are 30 seconds or less, our rules oftentimes do not apply in those situations. And there are other circumstances in which our rules do not apply. Next slide, please. Now, when it comes to the captions that those video programming providers generate, we have to also talk about the quality of those captions. There are certain standards that they must comply with. For example, the captions must be accurate. They must fit the spoken language as accurately and as closely as possible. The captions must also be synchronous, which means that the captions should be appearing on the screen around the same time as those words are being spoken during the program. And those captions should also be provided at a speed that is reasonably readable. And that can sometimes be a challenge when you have a rapid fire dialogue happening in some sort of program you want to make sure the captions are there long enough for the person to be able to see and read those captions. The captions should also be complete. That's another one of our captioning standards, which means that they must run from the beginning of the program until the end of the program. Now, the challenge with that in some cases is if you have a dialogue that continues until the very last second before the commercial break, if the captions are being generated during the program up until the end, sometimes those captions are cut off before the commercial is or as the commercial is shown. So the last couple lines of captioning may not be shown on the screen because of that commercial interruption. And that's why in some cases you might see in reruns, you might see the next scene, or rather the captions are cut off. Last couple of seconds are cut off before the captions come on. Now those captions should be running and should not be cut off and should be completed until the end of the program before the commercial begins. And finally, the captions should also be properly placed. This means that the captions would either be at the bottom of the screen or perhaps at the very top of the screen. That way, if there are words that are being shown on the screen, such as, for example, if there are some sort of credits in the show, or if there's a dialogue and you have a person's name that's actually being shown on the screen, the captions should not cover up those things that are being shown on the screen, or vice versa. What's being shown on the screen should not cover the captions. Or, for example, scores in a sports game should not interfere with being able to read the captions. So the captioner or the video programming folks need to make sure that the captions are placed properly in such a way that the viewer is still able to see both the captions and any words that may be on the screen, and they shouldn't be interfering with anyone's face or anything like that. We welcome comments or complaints from consumers regarding poor captions or lack of captions for that matter. There is a link that we've made available on the slide, which will also be shared with all of you, that talks about how individuals can file complaints regarding accessibility issues related to captions or to any other telecommunications areas. We would encourage you to take a picture or a short video of any poor captions that you see. Next slide, please. Now, another way that the FCC can assist you is, especially for those individuals who are older Americans and who may be losing their hearing, is to be able to provide captions for telephone conversations. Without, of course, recording those conversations. Those captions will be made available only for the conversations themselves. So when a person experiences hearing loss, in many cases, they can still speak for themselves, but they may use a captioned telephone service in which the individual is able to read the captions that appear on a screen on a telephone that shows the captioned conversation. That way, the person who is on the other end of the phone of the conversation who is speaking, their words will appear on that screen as captions. So the older American with hearing loss would be able to listen and also read captions at the same time, and then respond back in spoken language as well. There are also captions that are available for mobile phones. So captions can be read on a person's mobile phone. The individual can then speak back to the person on the other end and then listen and read the captions at the same time. Now, this is one example of telecommunications relay services, which we ensure the certification of those various relay services. And those services allow people who are deaf and hard of hearing and who are deaf-blind or who may have speech disabilities or hearing loss to be able to communicate and access information through those telephone services in a way that is functionally equivalent to a person who would be using a phone service who does not have a similar disability. We certify various types of relay services based on whether or not a person uses sign language, such as myself, to communicate, which would use sign language and video technology, or if a person is using spoken language, but who also relies on captions in order to understand what the other person is saying. Now, in terms of that specific form of relay service, that is known as Internet Protocol Captioned Telephone Services, or IPCTS. This service allows individuals to use a captioned telephone service to be able to communicate with people through the telephone. We currently have 9 certified providers who are able to provide IPCTS captioned telephone services. And this service is free of charge. The only charge is that you must have a telephone line available, but the caption service is free of charge to users. It's available 24 hours a day. And some captions are provided via human captioners, whereas other captions are provided through what's known as automated speech recognition, or ASR, basically using AI or artificial intelligence. And if you need more information about these services, we also have a link available at the bottom of this slide. Next slide, please. I'm going to toss it back to Kayla for this portion of the webinar. Thank you.
Thank you, Josh, for sharing wonderful information with our attendees here today. So this is where we're starting to wind down, but first we want to talk about consumer outreach and partner resources. Again, I'd like to share that the slide deck will be shared with all registered attendees. If anyone has any questions, please send them to outreach@fcc.gov. I have been informed that we are having a few technical issues with actually the Q&A portion of this. Next slide, please. So here are some of our resources. As you've seen links throughout the slides that were presented today, we do want to do a recap of the resources available to consumers from the FCC. We have our Consumer Help Center, which houses a lot of information, including our tip cards, our consumer guides, and most current information that we'd like consumers to know about. That Consumer Help Center is available fcc.gov/consumers. We also have our Consumer Inquiries and Complaints Center for more information about issues that are affecting consumers that you may want to file a complaint with the FCC. There are lots of resources and information there, including the forms, which if you need to proceed with a complaint, that you need to fill out. Our website is there for you. Some of the things that were discussed today, like the hearing aid compatibility for wireline and wireless phones, we have included a link here. Information to the FCC's Connect to Health Task Force, FCC's Virtual Volunteerism Workshop, which is the workshop that we talked about that was hosted in 2020, and of course information to the FCC's Disability Rights Office. Next slide, please. Again, I'd like to thank everyone for attending here today. If you have any questions, and we do apologize for the technical issue with the question and answer component of this, but please, any questions that you may have, send to outreach@fcc.gov. Whether the question is for the Consumer Affairs and Outreach Division, the Disability Rights Office, or if it is a question that is handled by one of our sister bureaus and other outreach offices, we will definitely be happy to forward those. And again, you can reach us using outreach@fcc.gov. Thank you to my team, and thank you to the Disability Rights Office for helping me with this webinar today. And we look forward to seeing you at our next webinar. Thank you.